Yeah, I'm Bill Wiedmeyer. I'm a CPA, been at the firm 45 years of Wiedmeyer, Schneider, and Ram. And actually, before I became managing principal, Rob gave me some very helpful hints and counseling during that time.
So what brought you here, Bill?
Well, my partner Steve Schneider has been coming, and he said he wouldn't be here, and he said if I want to go, it'd be a good time to see Rob again, and I appreciate Rob, so I'm here.
All right. Let's just go right around that table.
Hi, I'm Suzanne Jones, and I'm a surgeon in Chelsea currently with the process of setting up my own practice called Michigan Vein Care Specialist, which is over in outside of Arbor, and Kim Duffy from United Bank Trust invited me, and I'm excited to hear what you have to say this morning. Obviously, setting out on my own at this time when there's so much uncertainty in the direction the healthcare is going.
Great.
I'm interested in knowing information.
I'm Marie Clough. I'm with I Supply County. I specialize in
Yeah, you're going to have to speak loud because there's a background noise.
I'm Marie Clough. I'm with I Supply County, and I specialize in purchasing and supply chain management. I have my own consulting firms, and I'm here because I like Rob and I know
Good morning, I'm Dave Gorka. I'm with Wellness and Prevention, formerly Health Media in Ann Arbor. I'm actually in the process of moving on to my next opportunity. Rob has been giving me a lot of coaching over the years, and just here because of the wellness topic, and I'm interested in that.
So Dave, how long have you been with Health Media?
14 years, co-founder of Kickstarter.
And you're about to end, so it's a momentous time. It's here for Dave because he actually, big success story, Health Media here in town, and so.
Good morning. My name is Jan Davies McDermott. I own Echo Enterprises, which is a company that does OSHA compliance training for corporations that have safety teams. And so as a small business owner, I am very interested in how this will impact my company.
Okay.
Yeah. Good morning. I'm Gloria Brooks, President and CEO at Arbor Hospice, a member of the Washtenaw Health Initiative, and very interested in healthcare in general and how end-of-life care services will be a part of the Affordable Care Act. First time here at CEO.
Good morning. Josie Parker. I'm the director of the Ann Arbor District Library. I'm interested as an employer with over 200 employees who offer health care, and I go wherever Bob Guenzel is talking.
A lot of places.
Once it's not me, and I go where Bob Guenzel is talking.
Most everybody else is paying for this event, but yours is free as long as you waive my past due fee.
Well, if you hadn't told me you have them.
Mark Parnes, Associate Vice President for Research at the University of Michigan, and I would never miss the CEO Connect breakfast. I also think we have a wonderful panel this morning.
Go over this way.
I'm Karen Onions. I work at the Center for Healthcare Research and Transformation, and I'm the project manager for the Washtenaw Health Initiative. And I'm here because I support you guys.
I'm Mike Shaw. I do communications with Emerson School in Ann Arbor, which is the gifted school for independent school for gifted children. And I'm here because I just recently moved back from Los Angeles a couple months ago, and just looking to get more connected with our community. And CEO Connect sounded like you go.
That's the most Los Angeles-like of all events in Ann Arbor.
Good morning. I'm Marissa Rodriguez. I work in outpatient operations at the health system, and I received an invite. The topic sounds perfectly relevant to what I do and am focused on in my daily work, so I'm excited to be here. It's my first time.
Thank you.
Good morning. My name is Larry Boykin. I'm the president of Capital Social Services of Washtenaw County. We're a partner with the Health Initiative and involved in lots of projects and services that tie into our topic this morning. That's great interest.
I'm Deborah Arlowski. I'm the Senior Learning Specialist at Human Resource Development at the University of Michigan. And I'm here because I know Rob and I'm a groupie, and even when there's a topic that I go, I'm not so sure it's relevant to my job, by the time I leave it is.
My name is Matthew Graff. I'm a CPA in town, and I'm a financial controller for Emergency Physicians Medical Group, a local provider in the St. Joe system. I'm on the CEO PATH mailing list, and I'm really happy to be at another amazing panel breakfast.
Great. Thank you. This way.
I'm Scott Scott Badnock. I'm the CEO of a small company called Badnock Science Invention Design, and I advise some of the senior leaders in our government on the topic of innovation.
I'm Steve Gill. I'm a consultant in organizational learning, also trustee of Washtenaw Community College, and healthcare is a huge cost to the college, a huge part of our budget, a growing part of our budget. So that's why I'm really interested to hear what the panel has to say.
I'm Patty Milgram, and I'm President and CEO of Integrity Rehab Services, and provide therapy for the elderly. So this impacts all of my employees I provide healthcare services for, as well as all of my patients that I work with.
Pam Sexton, and I'm with United Bank and Trust, and I'm manager of the Healthcare Services Group. And we look to provide financial services to healthcare providers and communities we serve.
I wanted to put on an event like this about a year and a half ago, a big event for Marianne was one of the speakers at that. And Pam in United Bank, one of the sponsors of this event. And so they should take every bite, enjoy it, because they paid for it. Sandy?
I'm Sandy Simon, and I'm an owner of Trillium Technology. We're a very small software company that sells imaging software to mostly cardiologists.
Candace Kolars. I'm currently unaffiliated. My most recent affiliation was Mayo Clinic of Health Promotion and Wellness. I do software development, program development, and Sandy invited me this morning. Interested in the topic.
Are you unaffiliated and looking to be affiliated? Or,
I'm looking to be affiliated.
I'm Ellen Vaughn, and last fall I formed Vaughn LLC with that very catchy name, and I'm sort of a gun for hire for people that need someone to help them do various things. I have a very generalist background, and I'm interested in health care because it applies to every single one of us. In the last year, I've witnessed a number of friends and family go through issues, and it's this area needs shaking up, and I'm happy to see that it's getting shaken up here.
I'm Dave Scaff, United Bank and Trust. I head up business banking. I echo all of Pam's comments. This is a very important space for us as a bank, and so we're very interested to hear the entire panel, especially our board member, Norman Herbert.
Zena Zumeta, Mediation Training and Consultation Institute, and I'm just always glad to be here and listen to it. It's always fascinating.
Tricia Garcia. I published the Ann Arbor Observer. A little sleep deprived because we're moving our offices tomorrow. Trading Zingerman's Deli for Zingerman's Roadhouse. We're right down the street with the
You're out Jackson Road?
Well, we're off Winewood, which is a little pass-through street that some of you may zip down between Maple and Stadium. So once we get settled, stop by and say hello. But I really wanted to be here this morning because I met with our health insurance representative the other day and saw that we had a premium increase of 21%. And even though we're a small business, that hits us hard, and I'm sure it hits all of you business owners.
Well, I'm going to turn it over to panel and let them get started, but I've had an opportunity to meet everybody. Bob, today's the first time we've met, but I've been very fascinated by the work that this group has been doing on thinking about the issues of healthcare coverage for those that have not had access to healthcare coverage. And we know what a tremendous problem that is, what a differentiator it is from pregnancy through early childhood through old age. And you know, we all struggle with our own issues around the expenses for healthcare, but so many people do not have access to it at all. And this wonderful group has worked for the last couple of years on this initiative to figure out how to bring healthcare services to everybody in the county. And during that process, the Healthcare Reform Act, I guess Mr. Obama has said now it can't be called Obamacare, so I'll use that term. I always thought it was a little derogatory, but he's embraced it. So with Obamacare, I think it's created lots of uncertainty. Many of you probably are for it, many of you are against it, but it's coming. Even if the election goes against President Obama, I think there's still going to be this legislation to deal with. And I consult to doctors, I consult to Blue Cross, and virtually in hospitals, virtually everybody is going like mad to try to figure out what it means, but it's very, very hard to get a grasp on it. So hopefully we can address, I think we'll start out with addressing the Washtenaw piece and then open it up to more of the national implications. So Bob, introduce Bob, and then Bob, everybody will introduce themselves. So Bob, I'll let you start with introducing yourself and go from there.
Thanks, Rob. We're really, all right. Is this all right?
Yeah.
We're really pleased to be here this morning, and it's a great cross-section of folks, I think, that have interest in many different ways in the work that we're doing. The Washtenaw Health Initiative, how would you define it? I would define it as a loose, unincorporated association of community members who are trying to do a better job of delivering care and providing access for a population we're focused on, and that's low-income individuals, Medicaid recipients, and uninsured. So, I spent several years as county administrator, and in that position, the county partnered with the two hospital systems, St. Joe's and UNM, to put together the Washtenaw Health Plan to help serve that population. And we were able to leverage about $500,000 of local dollars to bring in millions of dollars within partnerships with the hospitals to provide service for about 8,000 individuals. So there are 8,000 individuals in our community who wouldn't otherwise have insurance who are insured through the Washtenaw Health Plan. And under the Affordable Care Act, that'll actually be phased out because of the